The Honorable Juliet Cuthbert Flynn, OD, MP, Minister of State of the Health and Wellness, Mrs. Patricia Ingram Martin, or Chief Nursing Officer, Mrs. Nicola Merrick, Head of the University Hospital of the West Indies School of Midwifery, Mrs. Claudette James, Nursing Now Coordinator at the Ministry of Health and Wellness, awardees, registered nurses and registered midwives from all disciplines and sectors across the length and breadth of Jamaica, retired registered nurses and midwives, nursing and midwifery students, distinguished guests, ladies and gentlemen, members of the media, good morning. It is a pleasure on behalf of the executive arm of the Ministry of Health and Wellness to welcome you to the International Year of the Nurse and Midwife Excellence Award Ceremony, where nurses and midwives will be recognized for their sterling service in their practice. This is, in fact, the closing of the year of the activities sponsored by the Ministry of Health and Wellness. It is now time for us to invite the sweet presence of God as the captain of this function so that we can safely take off and have a smooth landing. Let me now invite Miss Karen Samuels, coordinator of the Spiritual Wellness Committee, to invite the presence of the Lord in our midst.
Our sovereign God and Father, thank you for today. Thank you for waking us up this morning. God, we are alive and well. We have health, we have strength, we have sound mind. What a beautiful day to be alive and well. We praise you and glorify you for keeping us safe despite what is happening around us. What a privilege it is to be in your presence, because in your presence there's fullness of joy.
Yes.
And so, Holy Spirit, we invite you in this place. We invite you in our lives. We invite you to take complete control of everything. And we pray that everything will be done according to your will and your plan. God, we put this specific event in your hands, and we thank you for leading the way. We thank you for the health ministry. Thank you for our leaders, the Honorable Minister of Health and Wellness, our new Honorable State Minister,
Yes,
or Permanent Secretary, or Chief Medical Officer, or Chief Nursing Officer, and all other leaders.
yes.
Grant them divine wisdom and guidance as they lead and make decisions on our behalf. Father, it is indeed an honor to be sharing in the Awards of Excellence ceremony, celebrating the year of the nurse and midwives.
Yes.
God, as they celebrate and are recognized in their professions, we thank you for each and every one of them. Lord, we know it isn't an easy job, and sometimes it gets rough. Sometimes the hours are long. Sometimes it can be overwhelming, but we pray that they continue to serve without giving up and to serve with excellence. We thank you for honoring them, Lord, at a time like this, so deserving as we face the COVID pandemic, knowing that they are at greater risk. So cover and protect and keep us safe, God, because we look to you as our protector. Thank you again for being with us as we give you the glory, the honor, and the praise in Jesus' name.
Amen. Thank you very much, Miss Samuels, for such a power-packed prayer. Indeed, we can feel the presence of the Lord in this place. At this time now, it's time for me to give the opening remarks. Now, colleagues, today is truly a special day as we recognize and celebrate professionals who have demonstrated their commitment to excellence. At this time, I'd like to acknowledge the executive arm of the Ministry of Health and Wellness, led by the Honorable Minister of Health, Dr. Christopher Tufton. Then our Minister of State, the Honorable Juliet Flynn. Our Permanent Secretary, Mr. Dunstan E. Bryan. Our Chief Medical Officer, Dr. Jacqueline Bisesor Mckenzie, and all the administration across the regional health authorities. This team that I just spoke about have been very, very active, supporting and leading out in a lot of the activities that we would have managed to put forward in this year of the International Nurse, Year of the Nurse and Midwife. And so I will just now turn over to Mrs. Patricia Ingram Martin, our Chief Nursing Officer, who is now going to bring greetings, and she will share a brief background of this Award of Excellence initiative. Put your hands together for me as we welcome the Chief Nursing Officer of Jamaica, Mrs. Patricia Ingram Martin.
Thank you very much, my deputy, Mrs. Karen Nelson. Madam Moderator, Mrs. Karen Nelson, the Honorable Juliet Flynn, State Minister of Health and Wellness, specially invited guests on site and on the virtual platform, ladies and gentlemen, colleagues here and on the virtual platform, members of the media, a wonderful morning to you all. I bring you greetings from the Ministry of Health and Wellness, and by extension, the Nursing and Midwifery Services Unit. It is indeed an absolute delight for me to be hosting this award ceremony. This year has been special in many ways. Special because the designation of the 2020 as the International Year of the Nurse and Midwife was successfully proposed at the 144th Executive Board of the World Health Assembly by Jamaica. It is special also as in response to the COVID-19 pandemic, it is highlighted that nurses and midwives are indeed the backbone of the health care services. It is also special that some of our hard-working nurses and midwives are being recognized for consistently demonstrating excellence in their practice. The year's celebration commenced with a great launch. And despite the setbacks due to the pandemic, much was accomplished. The Nurses and Midwifery Services Unit collaborated with the Nurses Association of Jamaica on the International Nurses Day activities, Leadership Development Lecture Series, and Orange Day webinar. We also collaborated with the University Hospital of the West Indies on the staging of the Dory Pattison Research Day. The Nursing and Midwifery Services Unit hosted the Mary C. Cole Memorial Lecture and recommended to the executive arm of the Ministry of Health and Wellness the acceptance of the Nursing Now Global Nightingale Challenge, which calls for employers of nurses and midwives globally to provide leadership development training for at least 20 nurses and midwives per country for the year. I am happy to report that the Ministry of Health and Wellness has accepted the challenge, collaborated with the Pan American Health Organization, Powell, and commenced training of 32 nurses and midwives in leadership development. The year's activities are culminated with this Award of Excellence ceremony, utilizing the virtual platform, as we know, we are really constrained by the COVID-19 pandemic. It is my philosophy that recognition of good work is an important motivator for the worker, and it also inspires others to work hard and to do their very best. Today, 35 nurses and midwives are being honored for their exemplary work. The award for excellence was conceptualized by the planning committee of the International Year of the Nurse and the Midwife, where it was decided that nurses and midwives who have practiced with excellence should be recognized and awarded for their work this year. A subcommittee was established to plan and execute the activity. The criteria and the number of persons to be recognized were decided with the input of the wider committee. A booklet was developed with guidelines for the process of selection of nominees and was sent to all directors of nursing services, all regional nursing supervisors, and all heads of schools of nursing and midwifery. And they were given timelines for the submission of the nominees. Now, who are eligible? Registered nurses, enrolled assistant nurses, and midwives who were registered and licensed or enrolled by the Nursing Council of Jamaica and are employed in the public or private institutions. These persons were all eligible. Now, there were 6 award categories, namely excellence in clinical practice, excellence in educational practice, excellence in leadership, excellence in management practice for both nursing or midwifery, excellence in quality improvement or research practice, and excellence in school nursing. The supervisors would have completed a Likert scale questionnaire outlining the qualities being sought, as well as submitting a short narrative describing the nominee and the reason for the nomination. Persons were chosen from each award category based on the highest scores from the Likert scale and also scores from the narrative, which were awarded by the judges. To ensure transparency, judges were non-nursing personnel selected from within the Ministry of Health and also external of the Ministry of Health and Wellness. Congratulations to all our awardees. One unknown author said, "Excellence is never an accident. It is the result of high intention, sincere effort, intelligent direction, skillful execution, and the vision to see obstacles as opportunities." Another author says, "Excellence is not a skill. It is an attitude." Colleagues, continue to practice with integrity and with the right attitude. I wish for you a wonderful and memorable celebratory function.
Thank you, Mrs. Patricia Ingram Martin, for your greetings and for sharing the background on the initiative that we have started. You really gave us an idea of the evolution of the initiative and snapshots of the activities of the year. And indeed, I must borrow from what you just said, that excellence is indeed not an accident. And so at this point in time, we're moving now further down into the program to hear a little bit more about excellence. And so it's time now to hear from our keynote speaker. The Honorable Juliet Cuthbert Flynn is a committed and passionate leader, one who has been serving our country with distinction since she was 16 years old. She's a 5-time Olympian, a multiple track and field medalist, a businesswoman, and a member of parliament for West Rural St. Andrew since 2016. A state minister now in the Ministry of Health and Wellness, Mrs. Cuthbert Flynn is primarily responsible for maternal health, HIV prevention and reduction of drug abuse. She is from Port Morant, St. Thomas, that's my parish. That's where my mother is from, and attended Morant Bay High School before emigrating at 16 years old. She proudly represented the University of Texas, Austin, yes, where she studied sociology while leading the school to a NCAA championship in 1986. She was inducted in the school's Hall of Fame in 2015. Mrs. Cuthbert Flynn enjoys nature, interacting and helping people, and a good, hearty laugh. She's married to Levon Flynn, and they have 2 beautiful children, Troy and Zara. Now, ladies and gentlemen, which better person could share with us about excellence today than one who has performed excellent herself? Help me put your hands together as we welcome our keynote speaker, the Honorable Juliet Cuthbert Flynn, State Minister in the Ministry of Health and Wellness.
Wow. Thank you so much for that lovely introduction. I was listening intently. I'm like, who is that? But thank you so much. And it's really, really a pleasure being here this morning. Our nurses, our midwives, our doctors, really. I mean, we have to appreciate you all for doing such tremendous work. And it's really an honor to be here this morning. Masters of Ceremony, Mrs. Karen Nelson, Deputy Chief Nursing Officer. Thanks again for that lovely introduction. Mrs. Patricia Ingram Martin, Chief Nursing Officer for Jamaica. Mrs. Nicola Merrick, Head of UA School of Midwifery. Mrs. Claudette James, Nursing Now Coordinator. Registered nurses, midwives, retired nurses and midwives, nursing and midwifery students, industry nurses, army, private sector, and school nurses, distinguished guests, ladies and gentlemen, members of the media, a pleasant good morning. 2020 has been quite a challenging year, and now more than ever, we can appreciate the role of our frontline workers, especially our nurses. The World Health Organization has designated 2020 as the year of the nurse and midwife. And fortunately, or unfortunately, depending on your vantage point, the world is facing arguably the greatest public health crisis this century. There are 2 ways to view COVID-19 pandemic: doom or gloom, or a grand opportunity. And this year, the importance of the healthcare worker became more apparent, and we all have the opportunity to show our healthcare workers more appreciation. Whilst dealing with their own challenges, this year our nurses took the opportunity to lead the charge in the fight against COVID-19. And I must say that they have shown us their mettle and a shining beacon and a hope for Jamaica. Nurses account for the majority of the technical human resource in the public health sector. Due to the hard work and dedication of the 4,051 nurses and midwives, Jamaica is definitely a place in terms in terms of healthcare. We also salute the hundreds of nurses and midwives who serve in the private sector, contributing greatly to the growth and development of healthcare in our country. As COVID-19 made its way across the island, some 22 secondary facilities were involved in the admission and care of persons who were adversely affected by the virus. Additionally, some 175 public health nurses are involved in COVID-19 testing and contact tracing, and we've seen how well that has worked for us across the length and breadth of the island. To date, 72 nurses and midwives have been directly affected by the virus, with no reported casualty, and that is in fact what we at the ministry here are extremely proud of. Nurses are also key contributor to the establishment, management, and maintenance of quarantine and isolation facilities in communities across the country. Nurses also manage and support isolation units in hospitals to accommodate patients who have contracted the virus. They also contribute to the development of policy guidelines for the prevention of transmission of the virus. They arrange host educational sessions and healthcare and other essential service workers, fire, police, caregiver in infirmaries, places of safety, schools, and hotels. And they also lead the teams for testing and, as I said, contact tracing in various communities. Throughout the pandemic, our midwives have continued to conduct home deliveries, yes, whilst ensuring that they meet the needs of patients within the provisions of care. Our nurses and midwives are critical partners in the achievements of the priority of the Ministry of Health and Wellness. These also include improved immunization coverage, sustaining the fight against non-communicable diseases and communicable diseases, and to decrease the rate of infant and child maternal mortality. Due to COVID-19, nurses have been working extra long hours, and we applaud them for that, to maintain standards and bridge gaps within the system. Additionally, the local health system continues to be impaired by our inability to adequately serve key areas of need. One such area is the provision of human resources for healthcare in remote areas of the country. Seeing that, the ministry is in an attempt to ease some of the burden and mental strain of our nurses and midwives, announced the launch of the $37 million staff welfare program in September. And I hope a lot of you took advantage of that. The staff welfare program focuses on the area of human resource management, staff engagement and communication, rest and relaxation, which you all need, COVID support, and wellness. Each component of the program is supported through strong collaboration with the private sector for the implementation of activities in year one. The program also ensures mandatory rest days for medical staff who have worked excessive hours, mandatory 48-hour results for staff members who have done COVID-19 tests, preferential rates in the hotels and our facilities to support all healthcare staff within the system, and family support and counseling for those most impacted by the disease. There are also provisions for increased engagement and support to management teams within the health regions and parishes to better help staff in facilities and offices. In the short term, the ministry will bolster the benefit package offered to our nurses to give more security of tenure and better housing arrangements. Our nurses and midwives are integral to the success of these efforts. With your invaluable ongoing support, the public health system will be able to deliver on good health outcomes for our patients and provide a positive and fulfilling work experience for those who offer care. As this year of global designation to our nurses and midwives come to a close, we continue to remain cognizant of the value of your work and contribution to Jamaica's healthcare system. You have made impacts to healthcare that will remain unmatched for years to come. The nation thank you immensely for your kindness and your invaluable service to us and our families. In closing, I congratulate all the awardees today who are being honored for your sterling contribution and service in your area of specialty. Commendations to the Office of the Chief Nurse and the Nurse Now program for spearheading this year's celebration. I look forward to many more occasions beyond 2020 where we can honor and celebrate our nurses and midwives. Thank you very much.
Can I have a more resounding applause for the State Minister in the Ministry of Health and Wellness? Thank you so much, Minister Cuthbert Flynn, for your address and for your support to our nurses and midwives across the length and breadth of Jamaica. Indeed, we have heard your charge. We have heard what you said to us today, and we will continue to wage in the fight against the COVID-19 and to continue to give of our excellence to the people of Jamaica. So, excellence is an outstanding feature of quality. Do you believe that? Yes. Excellence is to do a common thing in a common way. So it's not a different thing, it's just doing the thing in a common way. But in it brings out the beauty of excellence. And so at this time, this is the moment you have been waiting for. The time when we will now make our presentation to our awardees, of which you heard this morning that there are 35 nurses and midwives all together across Jamaica who will be getting an award for excellence. I'm going to be inviting Mrs. Claudette James, our Nursing Now Jamaica Project Coordinator, who will take us through the first segment. Miss Marsha Gay Jackson, will take us through the first segment of our awards to our awardees this morning. And as it relates to the awards, I just want to indicate to you that there are 6 categories that these nurses would be awarded under. They are clinical practice, management, educational practice, leadership, school nursing, and quality improvement and research. These are all dynamic areas that drives the profession of nursing and midwifery, and today all of these awards are well deserved. So my task would be to call each of these awardees, and I will do that with so much pleasure and so much dignity. And then you will hear a little bit more from the team about each of these awardees. And you will see the pictures of these lovely persons being showed up on the screen so you can acknowledge them and bask in the glory of really congratulating them as we go along. So our first category that we'll be going forward with is quality improvement and research. Now the following awardees The first awardee, is Mrs. Millicent Anderson Allen, who is a senior tutor of the Kingston School of Nursing.
Alison Allen is an evidence-based oriented midwifery educator who approaches midwifery education and practice scientifically. She demonstrates an insatiable appetite for research, transmitting this desire among colleagues and students.
Such a beautiful nurse, isn't she? And I'm going to ask that we hold all the applause until after we would have heard the information about the person and the picture being showed on the screen. So our next person is Mrs. Paulette Brown Peters. And this nurse is the Deputy Director of Nursing Services of the Sir John Golden Rehabilitation Center.
Mrs. Brown Peters demonstrates clinical expertise and a commitment to advancing nursing. She is involved in clinical research activities to ensure evidence-based practice in the provision of nursing care. She has co-published and presented a paper on Caregivers' Burden, Caring for Persons with Spinal Cord Injury at the Ministry of Health 2016 Research Conference.
Put your hands together now for Mrs. Brown Peters. Our next awardee is Mrs. Juliet Buchanan, a clinical nurse manager of the University Hospital of the West Indies.
Mrs. Buchanan consistently displays keen interest in research. She actively leads research activities. Her knowledge and expertise in this area has enhanced the impact of the Quality Improvement Department on the provision of evidence-based practice in patient care at the institution.
Our next awardee, Mrs. Cheryl Burke Walker, a neonatology nurse from the Port Antonia Hospital.
Mrs. Burke Walker demonstrates commitment for quality improvement in clinical practice, continuously seeks new knowledge to guide the quality of patient outcomes. She works collaboratively with other members of the health team, ensuring patient-centered care.
Miss Savannah Haven, registered nurse of the Hospital Jamaica Limited.
Ms. Heaven has displayed the value of continuous learning through research. She has contributed to the implementation of practices that improve efficiency and consistency in the provision of quality patient care. She works mutually with team members in developing strategies for hospital development. She is actively involved in research committee.
Miss Christine Prince, a ward manager of the Maypen Hospital in the Southern Region Health Authority.
Ms. Prince, her focus and initiative resulted in clarity of evidence-based practice, projects, and decision-making among team members. She established tools for measuring patient safety and the quality of care provided that improved clinical practice. She established an environment that fostered research practice.
And the last awardee from this category is Mrs. Julian Scarlett, Supervisory Nurse Practitioner from the Western Regional Health Authority.
Mrs. Scarlett is a stickler for quality improvement and is passionate about research. She is constantly engaged in conducting research studies, comparing local and international findings to ensure that our practices are truly evidence-based.
So that is our category of quality improvement and research. So I now move on to the category of clinical practice. And our first awardee is Mrs. Canis Campbell, nurse manager of the Nowell Holmes Hospital from the Western Region Health Authority.
Mrs. Campbell is knowledgeable, results-oriented, who promptly and appropriately responds in an emergency. She displays excellent critical thinking skills and brings a sense of calm and objectivity in the clinical environment. An advocate for patient-centered care who guides members of the team in the provision of quality patient care.
Miss Spinclovel Campbell, an enrolled assistant nurse from Port Antonia Hospital in the Northeast Regional Health Authority.
Miss Campbell is a dedicated nurse who displays compassion and respect in caring for her patients, an exemplary professional who advocates for the provision of patient-centered care. Her commitment to the provision of nursing is undeniable.
Mrs. Maha Latibodir, nurse manager of the Kingston Public Hospital here in the Southeast Region Health Authority.
Mrs. Latibaudier is an efficient clinical manager who coordinates the activities on the unit to ensure positive patient outcomes. She coaches members of the team for the provision of quality patient care.
Mrs. Anna Martinez Serrano, critical care registered nurse from Hospital Jamaica Limited out in the Western Region Health Authority.
Mrs. Martinez Serrano is passionate on ensuring the provision of exemplary care to patients in critical care. She demonstrates leadership skills, is compassionate, and is flexible in the performance of her duties. She demonstrates professionalism in interacting with patients and co-workers who speak of her delightful care and attitude.
Miss Shame Ashe Ramdon, registered nurse, registered midwife of the Anota Bay Hospital in the Northeast Region.
Miss Ramdon is a knowledgeable professional who displays commitment for the provision of quality patient care. She enthusiastically advocates for patient and staff welfare and ensures timely interventions to address the issues. She mentors junior staff, assisting them in the improvement of their practice.
And the last awardee in that category is Mrs. Natasha Thompson Powell, enrolled assistant nurse from the Mandeville Regional Hospital in the Southern Region.
Mrs. Thompson Powell is an assertive, compassionate, and knowledgeable professional who advocates to meet the needs of her patients. Very perceptive, displays sound clinical judgment, ensuring that patients and their families are educated to participate in decisions regarding their care. Her analytical skills are remarkable, which enhance care delivery.
And now we move on to the category of leadership. Our first awardee is Mrs. Juliet Dancia Fraser Clark, ward manager of the Percy Junior Hospital in the Southern Region.
Mrs. Fraser Clark is an exemplary leader and role model who inspires others to achieve excellence. She mentors and monitors staff, ensuring the provision of quality patient care. A professional who is involved in the activities of the Kiwanis Club, empowering youths.
Mrs. Sonia Lewis Kalam, mental health officer, Westmoreland Health Department, Western Region Health Authority.
Mrs. Lewis Kalam demonstrates sound leadership qualities and emotional intelligence in providing guidance and ensuring that appropriate resources are available for the health team. She established effective public-private partnership for the provision of food services for mentally ill clients across the parish of Westmoreland. She plans and organizes mental health clinics outside of regular clinic hours, ensuring that patients receive relevant care.
Mrs. Diane Lopez, registered nurse from Hospital Jamaica Limited, Western Region.
Mrs. Lopez is best described as a leader who speaks through her eyes and leads with her smile. She established a healthy, productive environment that encourages team members to excel. An excellent listener, solution-oriented and diligent, displays a positive attitude in the performance of her duties.
Mrs. Donette Maxwell Green, enroll assistant nurse from the Black River Hospital in the Southern Region.
Mrs. Maxwell Green is an effective communicator who empowers team members to excel, a professional who is involved in programs that enhance the provision of quality care. She is committed to the organization's mission and advocates for the welfare of patients. She plays an active role in her professional association.
Mrs. Nicola Georgia Merrick, head of the School of Midwifery for the University of the West Indies, right here in the Southeast region, and she's right here in this room.
Mrs. Merrick established the first online delivery of a midwifery program in Jamaica to ensure continuity of the program in response to the advent of COVID-19 pandemic. She is committed to the use of evidence-based practice in patient care and has served as chair of the research committee at the Nursing Council of Jamaica. She currently serves as editor of the Jamaica Midwives Association magazine.
And our last awardee for this category is Mrs. Antonia Richards Stewart, nephrology nurse from Kingston Public Hospital, Southeast Region.
Mrs. Richard Stewart is an excellent team builder who embraces challenges. She has led the team in caring for patients on the COVID-19 ward, a dedicated, reliable professional who is self-directed and pursues lifelong learning.
So at this time, we'll be taking a short break. And now you'll be invited to relax and enjoy a special selection from Mr. and Mrs. Rushton, both who have displayed excellence in the area of music. Dennis is a famous judge, most of you would know, from the All Together Sing, one who is on the cutting edge as an outstanding musician, and Carlissa, an outstanding public health nurse, one who has been working in the profession for over 14 years. Currently, she serves as a public health nurse. That means she's on the front line, waging in the fight against COVID-19. One who has a soft spot for music, that's it, a soft spot for music, and that's why she's here today, to hold hands gently with our lovely, charming husband as she serenade the nurses on their award function. Put your hands together. Put your hands together for the Rushtons.
Some dreams live on in time forever. with the promise I made. Put it all on the line. What I hope for last will be mine. If I could reach higher, just for one moment touch the sky. For that one moment in my life, I'm gonna be stronger. Know that I've tried my very best. I put my spirit to the test. If I could reach some dreams are meant to be remembered. Those days you finally touch the stars, and I'll go the distance this time, seeing more the higher I climb. That the more I believe, or the more that these dreams will be mine. If I could reach higher, just for one moment touch the sky. For that one moment in my life, I'm gonna be stronger. Know that I've tried my very best. I put my spirit to the test. If I could reach don't waste your time with thoughts of giving up. It's all in your mind. Let it go, let it go. I'm here to remind you that anything is possible. Yeah, 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 yeah. So I'll do whatever it takes. Follow through with the promise I made. Put it all on the line. What I hope for last will be mine. If I could reach higher, just for one moment touch the sky. For that one moment in my life, I'm gonna be stronger. Know that I've tried my very best. I put my spirit to the test. If I could reach, if I could reach.
Wow. Simply awesome. Enriched. Indeed, strong message coming out through such a powerful song. If I can reach higher. And it was delivered by a beautiful individual. What a beautiful couple as well. What a combination. Wow. We will continue to remember this. Not the dream this time, but the reality of the awards function of the International Year of the Nurse and the Midwife. Thank you, Mrs. and Mr. Rushton, for a fantastic performance. You have enriched our ceremony this morning. Now we will be moving right back to continue our awards. And our next segment is management. And our first awardee is Miss Renee Chung, a neonatology nurse from the Black River Hospital, Southern Region.
Fosters an environment that enhances cohesiveness among team. She works assiduously to ensure the provision of patient-centered care. She has implemented initiatives to mitigate challenges and to ensure safe work environment. A true professional.
Yes, keep the applause going. Mrs. Marlene Sharmarla Elliott, registered nurse of the Hospital Jamaica Limited, Western Region.
Mrs. Elliott displays exemplary attitude, positive energy, and enthusiasm in leading the team, ensuring the provision of quality patient care. She displays excellent listening and coaching skills and is innovative in addressing challenges.
Miss Lorna Rosemary McDonough, nurse manager of Anota Bay Hospital, Northeast.
Ms. McDonough enthusiastically fosters a collaborative work environment, encouraging team members to maintain excellent performance in the provision of patient care. A dedicated professional who models commitment to the profession of nursing.
Miss Angelica Morgan, award manager from the Maypen Hospital, Southern Region.
Ms. Morgan displays excellence in the management of patient care. She is committed to team cohesiveness and is a positive role model for adherence to hospital policies regarding attendance and punctuality. An advocate for patients who ensures the provision of optimal patient-centered care.
Mrs. Isola Muthra Brown, nursing supervisor of Sir John Golding Rehabilitation Center, Southeast Region.
Mrs. Muthra Brown is a highly skilled, resilient, and tenacious professional who ensures a safe working environment and the provision of quality outcomes for her patients. A team builder who demonstrates a commitment to professional integrity.
Mrs. Charmaine Rosemary Vassal Shuttlewood, senior public health nurse of the Kingston and St. Andrew Health Department in the Southeast Regional Health Authority.
Mrs. Vassal Shuttlewood is a warm, caring, and empathetic professional who is guided by ethical principles in the management of patient care. A change agent who relies on evidence in standardizing practice to improve patient outcomes. A positive role model dedicated to staff development.
Now we're on to the category of educational practice. Our first awardee is Miss Meshonette Appleby, in-service education officer of Sir John Golding Rehabilitation Center, Southeast Region.
Ms. Appleby creatively championed the development and sustainability of staff development initiatives. She utilized various methods of delivering information, ensuring that team members are kept abreast of current trends in healthcare delivery.
Mrs. Carol Atkinson Morris, senior tutor of the Kingston School of Nursing, Southeast Region.
Mrs. Morris is a dedicated educator who displays a high level of professionalism in the performance of her duties. She is innovative in utilizing resources to address the needs of the students, a team leader who fosters inclusiveness among teams, enhancing productivity.
Mrs. Dorcia Brown Lyle, nurse manager and in-service education officer from the Black River Hospital in Southern Region.
Mrs. Brown-Lyle is an innovator who has conceptualized and executed multiple educational initiatives, which includes the annual Spring Symposium for Health Professionals in Western Jamaica. She displays creativity in conveying educational messages, a purpose-driven and motivated professional who aspires and inspires.
Miss Jacqueline Leakey, Nurse Manager from the Mandeville Regional Hospital, Southern Region.
Ms. Leakey is a knowledgeable, dependable educator who exudes warmth in interacting with colleagues and students. She is persistent in ensuring the success of slow learners, a professional who readily develops initiatives to mitigate challenges.
Miss Shawnette Lynch, Nurse Manager and Infection Control Nurse from the Noel Holmes Hospital, Western Region.
Ms. Lynch is passionate about education of staff on infection prevention and control practices to prevent transmission of infection during the COVID-19 pandemic. She developed the body system among team members and conducted refresher sessions to ensure that deficiencies in practice are corrected. She conducts audits to maintain standards in infection prevention and control practices to ensure risk reduction.
And the last awardee from that category is Mrs. Nakisha Mckenzie, Infection Prevention and Control Nurse from Port Maria Hospital, Northeast Region.
Mrs. Mckenzie effectively utilizes various resources to accommodate individual learning needs. She is committed to assisting team members in developing competencies towards achieving their professional goals.
Now we are down to our last category, the category of school nursing. And our first awardee, it is Mrs. Angela Forbes, school nurse from the Northern Zone.
Mrs. Forbes demonstrates a zeal for knowledge to enhance her performance as a school nurse. She has been involved in planning several health fairs in the community. She volunteers her expertise at the St. Christopher's School for the Deaf.
Mrs. Marion Price Robinson, school nurse from the Southern Zone.
Mrs. Price Robinson is a published author of Teen Talk. She is a disaster shelter manager, public speaker, researcher, counselor, mentor, and children's advocate. She has executed quarterly wellness initiatives based on identified needs of the school community. She contributes to the advancement of the organization in developing an emergency protocol for non-medical school personnel.
Mrs. Millicent Thompson, school nurse from the Western Zone.
Mrs. Thompson is committed to the welfare of the students and staff in the school community. She spearheads school health, safety, and nutrition committees and collaborates with the guidance counselor in addressing students' needs. This professional has coordinated health fairs, initiated community outreach programs, and has conducted health education sessions.
And our last of the 35 awardees is Mrs. Tracy Thompson Mclean, school nurse of the Central Zone.
Mrs. Thompson Mclean has a passion for nursing. She is an optimistic role model for her students and has established an environment that motivates her students. She is one of the coordinators of the Jamaica Moves program at school and is involved in the planning of health fairs. She conducts health education sessions at the Parent Teachers Association meetings, and she is an entrepreneur. She is CEO of the Thompson Holistic Home Care Services.
Wasn't that a lovely exercise? Isn't that excellence in all forms? Excellence right across from one end to the other. And the nurses were looking, and midwives were looking so beautiful as their pictures were displayed. At this time, I must thank Mrs. James, our Nursing Now coordinator for the Jamaica chapter, and our coordinator for the International Year of the Nurse and Midwife Committee, and our administrator for the Nursing Now Jamaica project, Miss Marsha Gay Jackson, for taking us through this segment with such flawless representation and excellent performance. Thank you so much. So at this time, I just want to leave an excellent word to the awardees. Well done, awardees. You have demonstrated that despite the challenges, you can continue to practice with excellence. That's the buzzword for today, excellence. So at this time, I'll be inviting Mrs. Nicola Merrick, I have to be careful here, to respond on behalf of the awardees. Put your hands together as we invite Mrs. Nicola Merrick to make a presentation on behalf of the team.
Thank you so much. Thank you so much. The Honorable Juliet Cuthbert Flynn, State Minister in the Ministry of Health and Wellness, and our keynote speaker, Mrs. Patricia Ingram Martin, Chief Nursing Officer of Jamaica, Mrs. Karen Nelson, Deputy Chief Nursing Officer of Jamaica, Mrs. Claudette James, Coordinator of the Nursing Now program, and her lovely assistant, Ms. Jackson, distinguished guests in house and on the platform, I greet you well. It is my esteemed honor and pleasure to give the response on behalf of the recipients of the International Year of the Nurse and Midwife Award of Excellence. We are truly humbled and heartened to be acknowledged in this manner for our contribution in building nursing and midwifery in this country through leadership, educational practice, clinical practice, management, research, and quality improvement. As you have been hearing all morning, the 35 awardees are registered nurses, registered midwives, and enrolled assistant nurses who represent the professions across the country at the primary and secondary levels of care, school nursing, and schools of nursing and midwifery. They were selected from a cohort of nominees that were submitted by directors of nursing, heads of schools, regional nursing supervisors, and school nursing zones. We, the awardees, want to thank the World Health Assembly and the Ministry of Health and Wellness for designating and endorsing 2020 as the Year of the Nurse and the Midwife. We thank you for honoring our contribution that we make on a daily basis. My colleagues and I have continued our profession on a journey of excellence, determined to uphold the high standards that have been set by our predecessors, some who are sitting in this room today. And you have been trailblazers in your own rights. And so we continue to build on that you have already done for us while we chart our own path. We pledge, therefore, to continue in your path of excellence as we chart our own course. I just want to say that the heights of great midwives and nurses reached and kept were not attained, no, not by sudden flight, but were not attained without our families and our workmates. You have stood to support, to challenge, and to encourage us. And you have built our professional lives. And you have been there for us. And so I believe that you should be honored as well, and you should take a bow. And so we like to say thank you to our family members and to our workmates. We want to also thank this ministry for the support and for this beautiful program today as you celebrate the invaluable work of the nurses and midwives across this island. Thank you so much.
You know I'm going to ask for a better applause for the lovely lady. Indeed, we have heard you, Mrs. Merrick, on behalf of the team, and we will continue to be that support to the team going forward and beyond. And we are just asking that you all just live to your promise and to continue to give of your service to the people whom we serve. And at this time, we're down to our vote of thanks. Now I'll ask the lovely lady, Mrs. Claudette James, the coordinator of the Nursing Now Jamaica project and the coordinator of the International Year of the Nurse and Midwife Committee, to come forward and move the vote of thanks.
Master of Ceremony, Mrs. Nelson, the Honorable Juliet Cuthbert Flynn, State Minister in the Ministry of Health and Wellness, our Chief Nurse, Mrs. Patricia Ingram Martin, awardees, colleagues, ladies and gentlemen, it is with pleasure that I express gratitude for the successful hosting of this ceremony. It has had curves and gullies, but it has happened with the Lord's name, in the Lord's name. And other activities for this ceremony and other activities in celebration of this, the International Year of the Nurse and the Midwife, despite the restrictions resulting from the COVID-19 pandemic. For this project, for this session, thanks to Miss Karen Samuels for inviting God's presence in our midst, Mrs. Ingram Martin for greeting us and sharing information on these awards. Our guest speaker, our keynote speaker, the Honorable Cuthbert Flynn, for delivering the message and for highlighting the value of nurses in this fight in the pandemic, and also in general for improvement in the health services of this country. I must say thanks on behalf of our nurses and midwives for the initiatives that have been implemented by the Ministry of Health and Wellness in support for the nurses. But I warn you that our advocacy organizations are watching, so you need to deliver on those plans that you have for us. Mr. and Mrs. Rushton, gosh, we could have you on for the rest of the day. Fantastic performance. It has really just boosted the whole energy of our function today. Mrs. Merrick, for your response on behalf of the awardees. I'm sure they're saying ditto, what you have said. Thank you for being here with us and for agreeing to respond on behalf of the awardees. Ms. Marsha Gay, for co-presenting the awardees. Well done. Our production persons, phase 3 for live stream and recording this event. we can have it for posterity, show it next year and the following year. And to you, our audience of 200 plus on the virtual platform, for your presence. Without you, we could not have made it. So thank you so much. The award recipients, we honor you. We do honor you. Mr. Stephen Davidson, Publicity and Communications Director for the Ministry of Health and Wellness, you're ours in the Office of the Chief Nurse. Thank you for your continued support throughout the year. At the drop of a hat, you are there to support us and guide. To the Ministry of Health and Wellness, the Permanent Secretary, the Chief Medical Officer, and the team of the Pan American Health Organization, they have been our support in more ways than one. I must say, as I pause here for the Pan American Health Organization, Mrs. Martin did mention the Nightingale Challenge and how they have just come on board to ensure that our nurses and midwives are trained in leadership development. Really, we're really grateful for that partnership. Most importantly, the members of the Year of the Nurse and Midwife Committee, Mrs. Julian Alexander, Ms. Carmen Brissett, Mrs. Dion Murphy-Nedrick, Ms. Carmen Johnson, Mrs. Patricia Ingram Martin, and Mrs. Karen Nelson, who are ex officio. We pull them here and there. Ms. Kellyanne Brown, Mrs. Sadie Williams Allen, Mrs. Antoinette Pattison Bartley, Miss Bobby Jo Campbell, Mrs. Jacqueline Welch, Mrs. Marcia Thomas Yetman, Mr. Alan Jeffrey, Dr. Heather Fletcher, Dr. Joy Little, Mrs. Patsy Edwards Henry, and of course Marsha Gay Jackson, our project administrator, who have worked tirelessly planning and executing all the events in celebration of this important year. But there are other persons. We have Miss McFarlane and Miss Phillipson, the secretarial staff in the office of the chief nurse. Although they are behind the scenes, they are there supporting us. So thank you. And thanks to the staff of the Nurses Association of Jamaica. They have put up with us for different activities. I say thank you all and wish you God's continued blessing for the season and for the new year. Thank you.
Awesome. Thank you so much, Mrs. James, for thanking us. And at this point in time, all good things must come to an end. And so I wish you God's grace as you continue to provide excellence in your practice and in the clinical area, within the community or in the classroom. Today, recipients, you are role models who have demonstrated that your practice have contributed to the improvement in Jamaica's health services through the provision of excellent care. Again, my heartiest congratulations to all the awardees this afternoon. I wish for you a safe and pleasant holiday as your journey continues. But before we go, let me invite the Rushtons to thrill our hearts again as we close the curtains on this Excellence Award ceremony of the 2020 International Year of the Nurse and Midwife. I thank you.
So I want wherever you are, you just help me by doing this motion. Hold him, Joe, hold him, Joe, hold him, Joe, and no let him go. Hold him, Joe, hold him, Joe, hold him, Joe, and no let him. The donkey want water. donkey want coffee and Tamara Sue. Hold him, Joe, hold him, Joe, hold him, Joe, and no let him go. Hold him, Joe, hold him, Joe, hold him, Joe, and no let him. The donkey want saltfish, the donkey want rum, the donkey want chocolate, juice make from June plum. Hold him, Joe, hold him, Joe, hold him, Joe, and no let him go. Hold him, Joe, hold him, Joe, hold him, Joe, and no let him go. Some me plant peas and corn down a gully, and he bear till he kill the poor Sammy. Sammy dead, Sammy dead, Sammy dead, oh. Sammy dead, Sammy dead, Sammy dead, oh. And no thief, Sammy thief, make them kill him. And no thief, Sammy thief, make them kill him. But a grudgeful, yes, a grudgeful, make them kill him. But a grudgeful, yes, a grudgeful, make them kill him. Ah, who says Sammy dead? Ah, who says Sammy dead? Ah, who says Sammy dead? Him no dead, oh. Ah, who says Sammy dead? I lie, them I tell. Ah, who says Sammy dead? Him no dead, oh. Mr. Rushton, I know that our awardees and our dear minister didn't understand a word that we said. I'm sorry, I'm bilingual. So let me translate it for you. Samuel planted peas and corn by the wayside. It bore fruit until poor old Samuel died. Samuel died, Samuel died, Samuel died. Oh, Samuel died, Samuel died, Samuel died. Oh, he was not a thief. That is not why they killed him. They were envious of his success. That's why they killed him. You know, every time I tell the story, I get emotional. But Mrs. Nelson told me she saw him last night. Who said Samuel died? Who said Samuel died? Who said Samuel died? He is alive, oh. Who said Samuel died? That is a lie.